Hello everyone, I am your host Anushka and you are watching E7 News. Let's begin today's bulletin. Karnataka Chief Minister B.S. Yediyurappa was on Thursday discharged from a private hospital here where he was undergoing treatment for COVID-19. The Chief Minister has called a meeting of his cabinet colleagues Thursday at 4 p.m. to discuss the pandemic situations. Yediyurappa was discharged from the city's Manipal hospital where he was admitted for the last 6 days, his office said. Speaking to reporters after being discharged, the Chief Minister said he has come out healthy. Instructions are being given to ministers to go to their respective districts and take necessary steps to control COVID-19. I had been in constant touch with the Chief Secretary P. Ravi Kumar and Law Minister Baswaraj Bommai for the last 4 days. We will discuss enforcing strict containment measures announced, he added. Even as India and Karnataka are grappling with vaccination shortage and its hesitancy, with COVID cases rising at an alarming rate, the tribal pockets of the Mysuru district have been recording impressive coverage, beating claims, predictions and doubts when it comes to inoculation among tribals. Thanks to a lower number of infections even during the highest spike last year and self-imposed restrictions, the tribal population has received much attention. These communities are now turning into a model for those living in urban zones where the vaccine supply chain is active but has failed to reach a significant share of the population. Jenu Kuruba, Solika and Hakki Pikki communities reside in the tribal hamlets of the Husur district of Mysuru. Out of 4,825 individuals with age group of above 45 and 60 with comorbidities, 1830 have been vaccinated so far, according to officials. Karnataka has asked the centre to supply 1500 metric tons of oxygen and 1 lakh vials of remdesivir in view of the growing COVID cases in the state. We have estimated that in the next 1 month, we may require 1500 metric tons of oxygen. In this regard, Chief Minister B.S. Yediyurappa has written to Union Minister for Railways, Commerce and Industrial Piyush Goyal. The State Health Minister Dr. K. Sudhakar told reporters here on Thursday. He said he too has written to the Union Minister for Health and Family Welfare Dr. Harshvardhan for supply of oxygen. Sudhakar said the state government had a meeting with the major oxygen generators in the state. Of them, JSW Steel is the largest one. We had a meeting with Sajjan Jindal and he has assured us to apply as much oxygen required in the state, Sudhakar said. The minister said after the meeting, JSW Steel supplied 40 metric tons in the last 2 days required for Bengaluru. The pandemic's second wave is picking up furiously in Karnataka, with the state breaking its own record of highest daily additions in COVID-19 cases. Almost on consecutive days, on Wednesday, the state recorded a whopping 23,558 fresh COVID-19 cases after witnessing 21,794 cases on Thursday. The third highest day's addition was recorded on April 18 at 19,067 cases. Consequently, the state's positivity rate has been spiraling and was at 5.08% on Wednesday. The positivity rate going up is not a good sign because this is happening despite the increased number of daily tests. On September 7 last year, when the number of tests had not been yet crossed 1 lakh per day, the state saw its positivity rate peak at 12.54%. However, despite the number of daily tests being considerably increased to over 1.5 lakh at present, the positivity rate has crossed 5% and going north. That's it for today. If you have any news to share, you can contact us at 1800 891 3722.